you're going to run for this office, and there are a number of issues that are before the people today, and you may have one or two that you perhaps like to touch upon.
Well,
whether it's
yes.
whether it's the national debt or whether it's going to war and whatever.
Couple things.
War on women or whatever.
War on women. The fact we're even saying that,
Yeah.
and everybody knows what we're talking about. There's a telling sign. It's 21st century, for Pete's sakes. We're always talking about how people need to stand on their own 2 feet, and I'm a big believer in that. But I also believe you've got to give people 2 feet to stand on, and you need affordable education, and you need a livable, sustainable wage, and I love this because I am a businesswoman. When I say, and I'll talk about that in a second, but I love to say or own your own business. This is vital, especially in this part of the world, in the 4th District. A lot of small businesses, and when we talk small business here, we're talking about a person saying, I wish I had some land. If I had land, I would grow bell peppers. And I could sure sell them a lot cheaper than what they're coming out of Holland from.
Based on what you're saying, you then would be in favor of increasing the minimum wage.
Of course I am, and we all can debate how much.
Right.
But to say, that a person cannot have a livable, sustainable wage is just crazy, and we're all waking up to that.
If you got to support a family, then it's not going to do it.
And for 40 years, and this is what we seem to overlook, it's whether it's hunger or whether it's a wage, we're always thinking about we don't realize it's been going on for decades. Hunger's been going on for decades. Lack of having a wage not only affects you while you're working, but when you turn 62 and or 65 and you go down there to see, well, what am I going to be getting on Social Security?
Which is another issue I need to bring up.
And because you've never made anything,
Right.
you don't make, and so you never can retire.
Right. But another issue of Social Security itself, I know there's been, I'm going to call it a tax on Social Security where they're trying to privatize it and so forth. What is your position on that?
We need to leave the money that is in Social Security. We need to leave it alone. This thing about all these pots of money and being taken out and this and that, that's not good. And privatizing is the most horrible thing I can think of to do. We see how business, big business, has gotten their hands on people's pensions. We see the big brouhaha going on about charter schools because of the influence of corporations now in the process. I mean, it's, we live in a representative form of government where we elect a voice to go up and speak for us, not the vested interest. And no matter what the issue is, it will always, for me, go back to who do you elect to Congress? Somebody who has taken money from vested interests, and at the very least, you have that perception that they are influenced by the vested interest, or someone who has refused to take it.
Another thing that right now our president is under constant attack for what he does or what he doesn't do. Doesn't seem to make much difference. But the biggest issue everybody's talking about these days, and maybe putting you here in the hot seat, Obamacare or the Affordable Care Act. Where do you stand on that?
And I don't feel in the hot seat at all.
Okay.
And I will answer any question and have answered this question. I actually answered it very early on when I was asked, well, would you have voted for it? And I said, I don't know if I would have voted for it. And of course, the person interviewing me thought I was trying to renege on it or somehow dance around it. And I said, no, I'm for the public option, not the private option where, here again, the companies, the corporations are in the driver's seat.
Okay.
I'm for the public option.
To put it in simplest terms, you're saying, let's just make Medicare for everybody.
Yes, that makes more sense to me. Yeah.
So,
What we are doing is not working. And let me give you one example because I gave it earlier. I got bit by a snake. And it cost $10,000.
Wasn't a politician, was it?
No. It was a good thing to ask. It was a North American viper. Now, the anti-serum for that is made in where? New Zealand. Now, I asked, why was it made in New Zealand? Well, they have sheep. They use sheep. I said, well, we have sheep in Arkansas. You know? But it cost $10,000. Now, that is one of the things that makes all of us crazy about the whole medical setup here. And by the way, when I'm in Congress, we're going to address that situation, and we're going to see if maybe we can produce it here in Arkansas, where we have the North American vipers. And this is serious, is that there are aspects in it, and this is where you throw out a little bit here and a little bit here, and it's like, okay, and this is why I didn't know what I would do, because being on your parents' plan until you're 26, if you've had a pre-existing condition.
Before the Affordable Care Act, it wouldn't have been possible.
Right. But I like to call it the Affordable Health Care Act, and quite frankly, for the president, someone told me that in 5 years from now, it won't be called that. Oh. Because it's going to be working, because there are things that need to be worked on, okay. and we'll work on it. And if enough of us start doing what I'm doing, which is having the tenacity to stick with it, get on the ballot, and get voted into Congress, we will have a voice for the people. And I don't know what it's going to look like. I'm only saying what and by the way, my master's thesis actually has to do with national health care.
Oh, there you go.
Okay? And I argue opposite what most historians have ever said about the rise of public health in the United States. They have said Americans have never turned to the state for help. The documentation is overwhelming. So I know what I'm talking about. I didn't just wake up one day and say, oh, I think public option is a good thing. No, I've studied it. Right. It's what's fair for everyone.